We know that it will mean the lives of people if we don't ensure that the return to work includes safety for workers.
Tonight, opposition parties in Ottawa call for caution as provinces are being reopened.
They say stay home, stay in the house, don't go nowhere. Stay in the bush, keep going.
And how a tribe survived the Spanish flu by living off the land. Good evening, welcome to APTN National News. I'm Melissa Ridgen. Canadian provinces are starting to relax restrictions by opening non-essential health services, retail stores, restaurants with patios, and golf courses. Some opposition parties have reiterated the Prime Minister's calls for caution. Jamie Pashagumskum has more from Parliament Hill.
Interim Party Leader Elizabeth May says there is friction between parties on whether or not to relax measures. May thinks people should stay home, and that includes members of Parliament.
Public health advice must be observed. We believe as Greens that members of Parliament should model the kind of behaviour we want to see, that we're asking everyday Canadians to embark upon.
NDP leader Jagmeet Singh understands people want to get back to work, but says there have been workplace outbreaks and deaths due to COVID-19, and workers should have the ability to stay home if they get sick.
We know that it will mean the lives of people if we don't ensure that the return to work includes safety for workers, paid sick leave, and ensuring that people have access to childcare.
In a meeting at the Special Committee on the COVID-19 pandemic, Deputy Prime Minister Chrystia Freeland presented concerns for Canada's senior population.
Our elders are now the generation most in need of our protection from the COVID-19 pandemic. They look to us to do what is right, responsible, and just, Mr. Speaker, however hard that might be. They look to us to forego, for now, the comforts and pleasures of gatherings and ordinary social interaction. They look to us to follow the advice of public health professionals.
Jamie Pashagumskum, APTN National News, Ottawa.
The province of Ontario has extended its COVID-19 emergency order by another 2 weeks. The measure was set to expire today, but will now be continued until May 19th. The order includes mandating the closure of all non-essential businesses and forbidding public gatherings of more than 5 people. The province has also announced it's extending a cut in electricity rates for both residential and business customers until the end of this month. Canada's chief medical officer says the federal government is working to address the recent COVID-19 outbreak in northern Saskatchewan. During today's COVID committee press conference in Ottawa, Dr. Theresa Tam said that the outbreak in the La Loche area is particularly concerning because it has reached First Nations and Métis communities.
Local and provincial public health have mobilized some significant number of health workers to do door-to-door investigation to see if there's any cases, to do case finding, contact tracing. So they are really seized with the issue, and they do have sort of on-site laboratory testing capabilities, but we're also there to support them if needed.
This week, the government of Newfoundland and Labrador announced new legislation that gives police sweeping new powers as part of the province's effort to limit the spread of COVID-19. Bill 38 allows police to enforce the province's travel ban. Under the new bill, officers can execute warrants or searches without a search warrant, detain individuals, search vehicles, and escort people to their provincial border. The new bill will remain in effect during the province's public health emergency. A homicide investigation in Thunder Bay has led to 2 arrests. City police announced today that a 21-year-old, Jarrett Shenawap, and an unnamed 14-year-old girl have been charged with first-degree murder. This is in connection with the death of 14-year-old Kaylee Ival. Ival was found dead near a city park on April 27th and was reported missing the day before. Both accused are in custody and scheduled to appear in court at a later date. A group of chiefs from the Interlake region of Manitoba are seeking an injunction against the province to put a halt on any construction work related to a multi-million-dollar flood channel project in the southern portion of the province. The Lake Manitoba Lake St. Martin Outlet Channel project will see the development of 2 channels to help divert flooding. The federal government has yet to approve the project, but the Interlake Reserves Tribal Council says the province has already begun construction on an all-access road, and they never were notified nearby communities were never notified. The Tribal Council has asked for multiple consultation meetings with the province, but say that they've gotten nowhere.
Sit down with my community, be a part of that process, tell them what the impacts are going to be of these channels, where they're going to be, they have never told us where they're going to be going through. It's a word of mouth where, from other communities, where these channels are going to be exactly going through, where they're going to making their cut. So all we want to know is what's the impacts of these cuts. We're not opposed to saving Manitobans, saving the city of Winnipeg.
We need to take another break, but still ahead, elders recount what it was like during the Spanish flu pandemic. First, though, here's tomorrow's weather. Starting off on the east coast, we've got 9 and sunshine for St. John's, 5 and cloudy skies for Halifax. Inukjuak -2 with a mix of sun and cloud. Kuujjuaq 1 and snow. Val-d'Or 2 degrees and sunshine. Gaspé 10 and sunny skies. 9 and cloud for Ottawa. North Bay some snow and 5 degrees. Same with Sault Ste. Marie. So look out, snowing and 4 degrees. Big Trout Lake some snow and -2. Churchill -3 and snow. Sunny skies for Thompson and 3 degrees. 9s for Dauphin and Brandon, sunny skies there. 8 for Gimli and Winnipeg, sunshine. 21 and sunny for Swift Current, 16 and sunshine for Regina. Buffalo Narrows, cloudy skies and 16 degrees, 9 and cloud for La Ronge, 9 and sunshine for Stony Rapids. Welcome back. While the nation's coping with COVID-19, elders pass on stories about pandemics in the past. Tamara Pimentel visited one community that was hit hard by the Spanish flu 100 years ago.
At a time like this, Elder Sam Aku picks up his drum and sings this healing song.
I've been singing this song the last couple weeks. This terrible sickness that hit our people all over around the world.
His home of Doig River First Nation in northeastern BC is shut down. Traditional gatherings cancelled. Here there is one confirmed case of COVID-19, and the community is waiting for the results of other tests. When the news hit, fear rippled through Doig that this will be a repeat of 100 years ago. The people of Doig River are part of the Daneza tribe, or the Beaver Indians. The Spanish flu in 1918 hit the tribe hard, wiping out 85% of the people. These mass burial sites are scattered throughout the territory in northern BC and Alberta. Some speak of the Beaver Indians as people of the past, but they still live in this region and haven't forgotten the stories passed on.
When the Spanish flu hit this area, it wiped out a lot of people. People talk about in the future, the people will turn this soil upside down. That's when the nature will attack. So I believe the nature is attacking us today. My dad survived through there.
Billy Atachi still shares stories of his father and how he survived the pandemic by living off the land. He says it's a lesson that can be learned in today's pandemic.
They say, stay home, stay in the house, don't go nowhere. Stay in the bush, keep going. And that's, don't come back. You'll be safer in the bush than stay in the house.
Nearly 4,000 Indigenous people across the country were killed by the Spanish flu. In northern Saskatchewan, on the Cumberland House Cree Nation, Elder Mary Louise McKenzie says those who stayed in communities didn't often survive.
I used to hear my dad talk about it, and he said he used to go out cutting wood for them, and he said sometimes I'd find them all dead.
Aku says it's important that these tight-knit communities take the COVID-19 pandemic seriously.
I think that's the only way to survive is keep your distance. I hope it don't last forever, but like right now, I would like to walk up to people and shake people's hand. You can't do that in the malls. So how would anybody feel if you are not careful, and then you catch it and then give it to your loved one, and then your loved one end up dying? How would you feel?
When restrictions on physical distancing are lifted, Aku says Doig River will hold its ceremonies again and pass down stories and songs to help younger generations get through the tough times.
After we're gone, who's going to sing it for people, and who's going to tell the stories? So it's very important to pass it on to next generations. In the past, many years ago, people saying there'll be sickness that will come. It won't have no cure. It's here today.
Tamara Pimentel, APTN National News, on the Doig River First Nation.
Last week we told you about Indigenous ceremonies like sun dances and sweats being cancelled or postponed. This week, Daryl Stranger looks at how people will connect spiritually on their own with these important ceremonies.
With the COVID-19 pandemic still going on, events like sun dances may still be postponed. Still, there's hopeful talk of some sweat lodges being reopened. But with the uncertainty, other things can be done.
We can go out on the land by ourselves. We can take our pipes or our drums or whatever sacred objects you have, and you can fast yourself for 4 days or 2 days or 1 day. Just being out on the land by yourself and getting in touch with that great spirit, that's the most important thing.
These are unprecedented times. Everyone has to adapt to pandemics, whether it's the Spanish flu that killed millions or COVID-19.
We've managed to survive and thrive despite all these adversities that we've been faced with over the generations.
Dr. Annalyn Wakagijic is an Indigenous doctor practicing medicine in Ontario. She believes togetherness is an important factor in the spiritual lives of Indigenous peoples, and some gatherings can still happen if safe protocols are followed.
Our tendency is to gather, like our instinct is to gather because we support each other. So we're having to once again adapt to contemporary times, and I think those types of social supports mean that we can still gather, but because we have the technology available to most of us, I think virtually is a necessary substitute in these times.
Mashkate says practicing Indigenous spirituality is important, perhaps now more than ever.
There's a lot of need for spirituality to reach inward to ourselves and find out who we really are, right? Like, we have to do that while we're all trapped inside anyway. It's good for we need spirituality in times like this. We really do. That's what gives us hope.
Daryl Stranger, APTN National News, Winnipeg.
Great story there, Daryl Stranger. What is it like to have COVID-19? Now the story of one man in British Columbia who caught the virus. He shared with APTN's Tina House what it's like to come so close to death and survive.
What started as a scratch in the back of Jerry Rice Weiss's throat on Thursday, April the 2nd, developed into a sore throat by the next morning, and then it got worse. He joined us by Skype from his home, where he is now recovering.
Whatever was going inside me, it was eating it up.
By April 21st, he was admitted to Surrey Memorial Hospital, where he tested positive for COVID-19. His wife, Angel White, posted this video on Facebook, which has been shared hundreds of times, explaining his symptoms.
Every bone, every muscle, every joint aches so badly. Their head felt like it was in a vice grip that would not let go. Having your throat get so swollen and inflamed that you're no longer able to eat or drink. The stabbing pain in the stomach.
Jerry became quite emotional recalling his experience while in the hospital at his lowest.
I knew I had a lot of support, but it wore me down. And at one point, I was going to call and say my goodbyes. That's the hardest thing.
He fought for his life and was able to come back to his family, but still test positive for COVID-19. Jerry's stepdaughter, Tamara, also tested positive, but only had a mild case, and she's now COVID-free. That was a few weeks ago, and Angel now has an update.
Each day he's getting a little bit stronger. Not saying he can go run a marathon yet, but at least he's climbing the stairs with a little bit more ease. His liver is still impacted by this virus, and they're still monitoring and waiting to go through more blood tests to ensure that there's no long-term impacts.
However, Angel says there is still a major flaw in retesting those that are positive after they were told to go to the nearest testing site.
He was too weak to drive, and he goes, my wife's in quarantine. If she leaves quarantine, she breaks that quarantine. She'll have to start from day one. How am I going to get to the hospital or get to the testing site without breaking their quarantine? So he dragged himself out, and he goes, I'll do this on my own and see how I do. And that's been their biggest issue, they said, is them trying to get people to the testing sites and then the worry of infecting others along the way.
I feel sorry for the people that didn't make it, where I was. And the smell and just seeing those people suffer is just unbelievable. I'll never get that out of my head.
Angel is not showing any symptoms, and her quarantine has just finished. Tina House, APTN National News, Vancouver.
On In Focus today, we had a panel of Indigenous physicians talk about COVID-19 from their very unique perspective, from traditional medicine and ceremony to preparedness to the challenges and successes that they're seeing in their communities as they treat this disease. Here's some of that discussion.
Honest, the pandemic has hit us. Our communities are in the northern part of Saskatchewan, particularly in the northwest, and we have some of the highest numbers right now. And I would say in our Indigenous communities, we are sort of the epicenter right now of the virus and of spread. And our numbers are still continuing to go high. We have, I think this morning I saw the numbers at 128 for our communities. So it is very, very scary for our communities, for sure. It's very frustrating on many levels, and I think we can get into that a little bit more as well. But it's also very challenging because it has so many new aspects to it. And I think what it really does at the end of the day is highlight the gaps that we see within our communities that we've seen for years, and the fact that we know that our communities are at a higher risk than the general population.
It's interesting that, we talked about primary care at the beginning and how there is no, regular family doctors or nurse practitioners providing acute care and preventative care on most reserves in Canada. And one of the things that I asked about when I first started working in Kihiwin about 3.5 years ago was the need for a crash cart. So if we needed to resuscitate someone before the ambulance makes it to the health center, and what we were told by Health Canada is that we don't qualify because we're not a remote community. So now that we're in the pandemic, some of that money that you just talked about, we've been able to purchase equipment like virtual otoscopes, or we're working on getting a virtual stethoscope so that we can see our patients virtually. So the question is then, is there primary care, are the reserves expected to deliver acute care and have that funded, or are they not? Is it only during a pandemic that we're expected to deliver acute care?
Yeah.
And if we have most health needs in the country, then why don't we have acute care, primary care on a regular basis? Why does it take a pandemic for some of these resources to be accessed by the community.
You can watch the whole episode online on our APTN News Facebook page. Well, it's time for us to take another break. First, here's the rest of Thursday's weather forecast. Over now to northern Alberta, we got 13 and sunny skies for Fort Chip, mix of sun and cloud and high level. Mix of sun and cloud and 17 for Edmonton, 18 and rain for Lethbridge. Campbell River, 18 and sunny skies, Vancouver, 16 and sunshine. 14 and sunny skies in Prince George, 16 and sunny for Smithers. Watson Lake, 16 and sunny skies, 14 and sunshine for Whitehorse. 5 and snow for Norman Wells, Wautee, mix of sun and cloud and 5 degrees. Tuktoyaktuk, -5 and mostly sunny. Sask Harbor, -10 and sunny. -10 and snow for Chesterfield, Whale Cove, snowing and -9. Igloolik, -9 and clear skies there. Arctic Bay, some snow and -7. Clyde River, -8 and sunny. Welcome back. Tuesday marked Red Dress Day in Canada, and one young Mi'kmaq jingle dancer is in Nova Scotia. She's honoring missing and murdered Indigenous women and girls in her own unique way. 7-year-old Shiloh Pictou danced almost a kilometer through her community of Buckingag in memory of her great-grand aunt, Anna May Aquash, who was found murdered back in 1975. That case remains unsolved, of course. She also danced to honor all missing and murdered Indigenous women and girls. Love that. The Canadian Hockey League's Calgary Hitmen have donated $15,000 to the Siksika Nation. The money comes from a February 1st game fundraiser called Every Child Matters. A part of ticket sales and food sales, which included Blackfoot delicacies like bison rib ends and berry soup, will be going to Siksika Health Services. The game included a round dance around the concourse. The nation will be using the money to help during this pandemic with a focus on youth mental health.
Not only did, we of course generated, some resources from the game, but to be able to use those resources and, put them forward in a way that can have a positive impact for our community and specifically for our youth. So the proceeds from the game were going directly in to support our youth.
Well, that is your news for this Wednesday. One last item, though, before we wrap up. We've all heard of American Idol, but have you heard of Jigging Idol? Professional jigger Ryan Richard started the event this month. Jiggers from across the country are welcome to submit their videos online to win cash prizes. Ryan Bolio from Sandy Bay, Ojibwe Nation, is looking to win the Best Jolly Jumper Jigger category. Let's take a look. Here is the 7-month-old showing off his skills. Note his grandma even made those little taps on those shoes. You can hear them. And here's 5-month-old Wase Lionel giving it his best. You can find Jigging Idol on Facebook to enter your own jigging video for a chance to win cash prizes. I'm Melissa Ridgen. Have a great night.